Welcome to Back in Balance, Holistic Approaches to Alleviating Back Pain. I'm Dr. Tina Schaffer, a licensed physical therapist at Neil King Physical Therapy. And today, I'll be guiding you through some exercises and stretches to help alleviate back pain. Before we begin, let's start talking about understanding our back pain. It can stem from a variety of causes, such as trauma, repetitive poor posture, muscle strain, and even arm movements. All causes can be made worse by underlying spinal conditions. It's important to listen to your body and seek medical advice if pain persists or worsens. Maintaining good posture is a key to preventing and reducing back pain. Remember to sit and stand long. Your goal should be to keep the distance between your belt line and your bra line or your mid-chest line the same in the front as it is in the back. Simply balancing forward or backward in your posture. Keep your belt core muscles engaged. Keeping your shoulders back, is what we've heard in the past, is actually not going to be helpful. Using the muscles that's in between the shoulder blades that are directly attached to the spine will help keep your spine in a neutral posture. From here, building on that, let's start with some gentle stretchings to alleviate the tension in your back by maintaining the flexibility in the hips. That's very important for your back health. We're going to learn some stretches to release our glutes, our hamstrings, our quads, and our hip flexors. But first most, we need to protect the spine. So let's go back to that pelvic tilt. A lot of times we find ourselves sitting and we've come into a slouch position where that distance between chest line and belt line is short in the front and long in the back. Or we've really come closer to our computer monitor and we're really short in the back and long in the front. Before we do any stretches, we want to protect the spine. Let's find that balance again. From here, we're going to release the glutes. So Denise is going to put her right foot on her left knee. As she does that, she's going to restore that core balance. Again, chest line to belt line stays even. Some people, this will be a stretch in the glute, and this is all you need to do. You'll feel that stretch in the outside of the hip of the foot that's up. Some people might have a little bit more flexibility. From here, we may just hinge forward. Oftentimes I say lead with the heart. And you're going to see that her back stays nice and straight, or it stays long in the back and equal in the front, so she can increase that stretch. You want to use your abdominal muscles to keep everything in line along with the back. Next, we'll move on to the hamstrings. To do this, you may need to move forward in your seat a little bit, and you're going to put one foot out straight. From here, I'm going to have Denise release her knee just a little bit, because if you have any history of spinal nerve injury, sciatica, you might need to release that knee just to let the nerve off the hook. Otherwise, it's the same position. She's going to maintain that core balance, the length in the front and the length in the back equal, and she's going to hinge forward at her hips so that the back, you can see her ear, her shoulder, and her hip are all in line, and she'll feel a gentle stretch. If Denise, you can show us where you feel that stretch on the back of your thigh on the right leg, that's where you should feel it. If you feel any numbness and tingling in your foot or any pulling into the calf, you may need to release your foot a little bit or give a little bit of a bend in that knee. I usually have people hold these stretches for maybe 3 to 5 breaths, which is about 30 seconds. Go ahead and push back with your legs back into sitting. Now we've released the leg muscles in the back of the leg. Let's do the front. So Denise is going to stand up. So we've got our hip flexors and our quads in the front. So if you just turn towards me, Denise, and put your left foot on the chair. From here, once again, it's going to sound like a broken record. We're going to balance that trunk again by keeping it nice and long, making sure we don't get too short in the front or too short in the back. And from here, she's going to move forward at her hip. And now you can see the angle of her trunk and the angle of her leg are different. So this is going to stretch her hip flexor, which is actually in the front of her body. You may need to engage your lower abdominals a little bit more because the hip flexor is attached to the back and you can actually be pulled into too much of an arch. Same thing, you might be able to adjust where your foot is on the chair to make it comfortable, to make sure, and this is a subtle stretch. They are subtle changes that make big differences in where you feel the stretch. Lastly, we're going to show you how to stretch your quad. Do you want to hold on to something for balance? If you can you're flexible enough to pull your foot up to the back, you're going to pull your foot from behind you. Once again, protect the spine. Abs and back in balance, and she'll feel the stretch down on the front of the leg here. If you don't have this level of flexibility, you can use your chair, you can put your foot on the chair and face away, as long as you've got something to protect your balance to make sure that you're staying safe. From here, we're going to come around to the table and we're going to start some strengthening exercises. Denise is doing a good job of keeping her back nice and straight as we do the traditional log roll to get onto whatever surface you're on. A firm surface is typically best. You can do these on your bed. Sometimes the bed is a little bit squishy, but there's value in getting on the floor. So if you've got a yoga mat at home or a softer surface, a carpeted floor, that's a great place to start. So from here, once again, we can talk about that neutral posture, keeping that balance from the front and the back. So if she arches her back too much, you can see how her rib cage pops up here. Vice versa, if she clenches too much, you can see how now her head is lifted off the table and she's very short in the front and she's jamming her low back into the table. What we want to create is balance. We want her back muscles and her front muscles and her pelvic floor to all work together. So from this position, she's just gonna brace and she's gonna start with those abdominal muscles engaging and pulling in towards the spine. When those activate, there's little muscles in your back that will create that muscle space and they will come together. The pelvic floor will come to the bottom and it'll keep her back nice and tight in a box. From here now, we're gonna try and challenge that by moving her arms and legs. So our monitor points are our hip bones and our rib cage. Those should not move. So from here, from a beginner level, Denise might just try lifting one arm up over her head and then bringing it back. And so she's gonna inhale as the arm goes up or exhale, whichever part of the movement is more challenging for you, but you do wanna maintain breathing. Then she might bring both arms up. It's a little bit harder for the rib cage, the upper abdominals, so she takes them up over her head. Notice her rib cage is not popping. If she loses her abdominal connection, all of a sudden you'll feel a big space through here. You want to bring those abs back in balance, keep that pubic bone in that low, and then she can continue. This is more of a challenge for the upper abdominals. Now we can go to the lowers. So now same thing, monitor points become more of our hips. We want to make sure that this boat doesn't rock. Keeps the abs engaged along with the back muscles, once again, to keep that length balanced in the front and the back. And she's going to lift this leg. And it might just be starting with this. This might be the challenge for you. We all start at different places. A lot of times this isn't a strength issue. This is just a coordination issue, learning how to use these muscles appropriately.
All right.
She may find that this is easy, so she needs to make it a little bit harder. This is where you got to make sure you've got your breathing under control and we're not holding our breath. So abdominal muscles pull in. Now she's going to lift her second leg and keep it up there. Notice Denise did a great job. She didn't move here at all. She can tap one foot down. She can alternate between the two legs. She needs it harder. She can bring her hands up over her head. She can take her arms up overhead, right? All until she finds her challenge point. Denise is doing great with these. Abdominals are pulling in. She knows it's too hard if there's any back pain or if either the rib cage starts to lift up or she starts to lose control. Once again, 20 to 30 repetitions is all you need to do. Variety is better. Go ahead and rest. Next, we're going to go into plank variations. All right, Denise has done a great job with demonstrating. The traditional name is the dead bug. You may find it under different names in different places. But now we're going to flip over and we're going to go into a plank. Sometimes we do the plank on our shoulders. Sometimes we do it on our elbows. It's up to you. I find that it's easier to do more variations if you're up on your hands than if you're on your elbows. So from here, she's going to bring her hands just a little bit in front of her shoulders. She's going to make sure that she's got that balance. She's not sagged in the trunk where she'd be short here and long in the front, nor is she going to be really tucked in tight here where she's now long in the back. Find that balance to protect the spine. Her abdominal muscles are lifting up to make sure that everything's coming together, and she's just going to bring her hips forward. This would be a beginner plank position. Her ear, her shoulder, her hip are all in line. Abdominals are engaged. You could hold this for 20 or 30 seconds. From here, you could make it harder. She's going to tuck her toes and just simply lift her knees. And then once again, maybe hold this for 20 or 30 seconds. A lot of times people like to hold this for 2 minutes. I personally don't find as much value in that, and it can get a little boring. So we can add different variations. You might be able to lift one leg and then bring it back down. You might be able to lift one hand. We could really challenge Denise and have her lift both arms and legs. And with that, she's really going to have to exhale, hold her belly muscles in. And we can see that that's a challenge for Denise right now. So that's what it might look like if it's too challenging. So she's going to work up to that. Belly muscles are in, hands come down. Show us what it looks like on your elbows, Denise, just in case some people have wrist issues and you can't do plank. So this is what it looks like on the elbows. You would do the same variation. So you could lift one leg, lift one arm. It is a little harder to lift your arms from this position though. So this might be more of a challenge. Good. Last one we're going to do is straight up onto hands and knees. It's called a bird dog. So if you're searching through the internet for what these names are, same thing. Back to that balance in the spine. I'm going to restore her balance here. Find that middle. So we know the cat and cow. It's not all the way up. It's not all the way down. It's in the middle. She's going to keep her head and neck nice and long because our head matters. Abdominal muscles in. Same as the plank. She might just lift one arm and bring it back down. She might lift one leg and back down. Now she's going to lift arm and leg, which means she just needs to prepare, and there we go, and hold. For these exercises, the planks, it could be a 30-second hold. Go ahead and rest. It could be 10-second holds for 10 repetitions. You're looking to challenge yourself, but not injure yourself. So if you start to feel any pain in your back, any pain anywhere that's outside of a muscle working, you need to stop, reset, and try again. Remember, consistency is key. When it comes to managing back pain, you can incorporate these exercises and stretching into your daily routine. And don't hesitate to reach out to a physical therapist or healthcare provider for personalized guidance. When to seek medical help is if these exercises don't work. You may get more pain or you may have more pulling, and the activities don't provide the relief that you're looking for. It's essential to seek healthcare assistance at that time. If you experience severe or persistent numbness, tingling, or weakness, you should not have pain after any of these activities. You need to seek some help. Thank you for joining me today. I hope these exercises and stretches bring you relief and contribute to a healthier, pain-free back. Stay tuned for more tips on how to lead a pain-free life on our channel. Click the link below to schedule a free wellness evaluation at one of our 10 Southeast Michigan Neil King Physical Therapy locations.